Let's discuss the Chinese and Western medical thought, the disease causation in Western medicine. The etiological standpoint attributable to Henle and Koch was based on what the Henle termed necessary and universal causes, by which he meant that a cause must always have the same effect. The cause must also be necessary for its effect. Applied to the tubercle bacillus discovered by Koch, this implied that anyone suffering from tuberculosis would have the tubercle bacillus in his body, and anyone with the bacillus in his system would suffer from tuberculosis. That is, the tubercle bacillus was necessary and sufficient for the contracting tuberculosis. Henle seemed to want to use this to characterize disease causation in general, but there was an unsatisfactory narrowness in his notion of causality. This was evident when he characterized doctors in the following passage. Only in medicine are there causes that have hundreds of consequences, or that can, on arbitrary occasions, remain entirely without effect. Only in medicine can the same effect flow from the most varied possible sources. For almost every disease, after a specific cause or the admission of such a cause is not yet known, one finds the same horde of harmful influences: poor housing and clothing, liquor and sex, hunger and anxiety. This is just as scientific work as if a physicist were to teach the body's fall because boards or beams are removed. Henle approved of the approach of the physicists who sought a single common cause, gravitation, to explain its instance of a class of similar events, the falling bodies, and felt that rational medicine should do the same. He criticized medical researchers of his time for attributing causation to events that immediately preceded the event instead of following the physicists and seeking universal scientific principles like gravitation. One could argue that Henle Koch's etiological standpoint often commits similar sin. For example, the bacillus that causes tuberculosis has an immediately preceding status, similar to that the removal of a board preceding the fall of a body. That is more pertinent in Henle's example of falling bodies to identify the motivation for identifying the cause of the fall. Depending on the motivation, the questions of who removed the board and for what purpose would be natural ones to ask. Indeed, if the falling body was that of a human being working on a construction site and that courts were trying to case of a homicide after someone removed the board on which the victim stood, no prosecutor on court would charge Newtonian gravitation with the crime. If an act of sabotage was involved in the removal of the board, the cause of the fall for the purposes of ascribing reprehensibility and meting out punishment would be the willful removal of the board by the saboteur. Henle's inept choice of example for the disease causation is symptomatic of the fact that the literatures of medicine and philosophy of science rarely intersect, even though the accounts of causation in the philosophy of science potentially could help elucidate the nature of disease causation. Consequently, the notion of disease causation is a subject with which modern epidemiologists have expressed difficulty. Stevens, for example, laments that the crux of the issue is the use and the meaning of cause in medicine. If epidemiology continues to disregard the misusage of terminology, it threatens the very survival of logic and science in medicine. Harder declares that it is totally pointless, hopeless, and downright silly to think one can ever state precisely what it is for one thing to cause another. As a matter of fact, the philosophical problem posed by Coach Henry Carter and others arises from focusing on necessary causes and not paying enough attention to sufficient causes. A necessary cause is often better viewed as the definition of disease rather than its cause. For example, the presence of tubercle bacillus in the body merely defines tuberculosis as a disease. A person in whom the tubercle bacillus has taken hold suffers from tuberculosis, but this says nothing about how the bacillus came to take hold in the patient's body. That is, the factors that combine and are sufficient along with the exposure to the bacillus to bring about his disease. Thank you for your attention.
Let's talk about interviewing the patient with regards to thirst, appetite, and taste. Inquiring about a person's eating habits, thirst, taste, preferences, and appetite can tell us a lot about the condition of the internal organs and factors such as heat, cold, yin, and yang. It will also help to identify possible etiological factors among the substances that the person ingests. For example, a person whose diet consists primarily of salads, cheese, and yogurt will have a tendency to develop spleen yang deficiency and dampness, while a person who regularly drinks alcohol can have a tendency to develop heat in the liver and stomach. So we will have to discuss by addressing a person's attraction to certain foods or drinks, their appetite, thirst, and so on, as a manifestation of possible patterns of imbalance rather than possible etiological factors. If there is heat present in the body, it will both injure and expel body fluids. These fluids must then be replenished. This means that a person with heat will experience thirst. One of the differences between excess and deficient heat is how powerful the thirst is. Excess heat, being more substantial, results in a thirst that is stronger. A person with excess heat will want to drink large amounts of cold fluids. They will also drink in large gulps rather than sipping small mouthfuls, which is more typical of a person who is yin deficient. When there is yin deficiency, the tissues in the body lack moisture. The person will often have a dry mouth and throat, especially at night. They will therefore not need to drink as often as a person with excess heat. They do not have the same need either for cold drinks to cool the body down, and they do not need to drink as much at a time. A person with excess heat will often have a large glass or a bottle of water nearby, which they quickly empty. A person who is yin deficient is more likely to have a glass of water standing beside the bed, from which they only drink a couple of mouthfuls. A person with damp heat will be thirsty due to the presence of heat, but the dampness will mean that they still do not feel like drinking or that they forget to drink. When there is excess cold and yang deficiency cold, the lack of transport and transformation of fluids in the body will mean that the person will have less need to consume fluids. They will therefore often have a lack of thirst. The presence of cold or the lack of yang will result in a preference for hot beverages to help to warm the body up. So, great thirst with desire for cold drinks, drinks in large gulps, indicates internal excess heat patterns. Thirst or dryness of the mouth and throat sips the water signifies yin deficiency heat. Lack of thirst or preference for hot drinks would mean cold patterns, yang deficiency. Thirst with no desire to drink is damp heat. The appetite should theoretically be a good indicator of the state of a person's spleen qi, poor appetite being a key sign of spleen qi deficiency in Chinese textbooks. Many of the clients we see in the clinic who are spleen qi deficient often say, however, that they have a healthy appetite. The reason for this is that people eat and drink for many reasons, most of which are not directly related to their nutritional needs. Eating food is closely connected to pleasure, comfort, bodily control, habits, boredom, upbringing, culture, procrastination. This means that the answers given in relation to appetite and diet must also be seen in this context. The spleen and the stomach have a determining influence on appetite. If there is spleen and stomach qi deficiency, the person will have difficulty transforming the food that is ingested, and the qi qi, the qi mechanism in the middle jiao will start to stall. It will manifest with a reduced appetite or being easily sated. Despite this fact, it is more common that patients who are spleen qi deficient will say that they have a good appetite, as will patients with dampness blocking the qi in the middle jiao. This is because people eat for many reasons other than hunger. If the patient consciously observes the sensation in their stomach, they will often discover that the sensation of hunger is located in the mouth or somewhere other than the physical stomach. You can ask the patient how their appetite is in the mornings. Many people with spleen qi deficiency, especially those with dampness or phlegm, will have no appetite in the mornings. They will often skip breakfast and only eat later in the morning, maybe after they have arrived at their job. This is because the stomach and spleen's qi is inactive while they are sleeping. When they arise, it will take a while for the spleen and stomach qi to start circulating if they are spleen and stomach qi deficient, especially if dampness blocks the movement of the qi. Thank you for listening.
Let's continue with the overview in our discussion on the diagnosis according to pathogenic qi. As mentioned before, an invasion of exogenous pathogenic qi is defined on the basis of its origin, that is, how it has arisen. For example, you can be invaded by damp cold if you get cold and wet after being drenched by the rain in winter. Pathogenic qi, though, is defined by how it manifests, that is, how it affects the body's qi. If something affects the body in the same way as, for example, exogenous cold does, it will be defined as being exogenous cold, even though the person has not been exposed to climatic cold. In general, there is no discrepancy between the way that symptoms and sign manifests and the climatic influences that a person has been exposed to. However, there are circumstances in which there has been no exposure to a climatic influence, yet the person still manifests symptoms and signs of an external invasion of pathogenic qi. Allergic rhinitis is a typical example of this. This is because all pathogens, like climatic qi, have specific qi dynamics. This is of great importance when treating people who have been infected with bacteria, viruses, and other invisible forms of infection, and when people react negatively to food additives, chemicals, and allergens. If exposure to a particular virus makes the body temperature rise, the eyes become red, the thirst increase, and the pulse beat faster, this virus is defined and thereby treated as heat pathogenic qi. This is because these physiological reactions are the reactions that occur when heat is present in the body. Conversely, if a person feels very cold, has cramping, intestinal and gastric pain, and watery diarrhea, this physiological reaction will instead be defined as being a cold reaction. This will therefore indicate the presence of pathogenic cold in the body, even though the person has not necessarily been exposed to anything cold. Something that is also important to remember is that when exogenous pathogenic qi invades the body, it can change character and transform into something else. It is, for example, very typical for invasions of cold to transform into heat patterns when the cold has penetrated the body. As mentioned earlier, each of the 6 exogenous forms of pathogenic qi has its own unique symptoms and signs, which are manifestations of its specific qi dynamic. There are, however, some symptoms and signs that will be seen in all invasions of exogenous pathogenic qi. This is because exogenous pathogenic qi will have a disruptive effect on the body's great qi. When pathogenic qi invades the exterior aspect of the body, there will often be an aversion to cold and chills, even if the invasion of exogenous pathogenic qi is of the exogenous pathogen is heat. This is because exogenous pathogenic qi blocks wei qi so that it can no longer warm the skin. There can also be a slight fever or febrile sensation, even though it is a cold pathogen. This is because the conflict between pathogenic qi and wei qi and the subsequent stagnation that arises will generate heat. The febrile sensation may not be particularly pronounced and may well not be measurable with a thermometer. In Chinese medicine, fever is defined by the patient's own subjective sensation of warmth or the therapist's observing signs of heat, such as a red color in the face or the skin feeling warm on palpation. An important diagnostic sign in invasion of exogenous pathogenic qi is that chills and febrile sensations manifest simultaneously. In invasions of exogenous pathogenic qi, the pulse will usually be superficial. An invasion of the body by exogenous pathogenic qi will be due to one or more of the following factors. Jiang qi is weak or weakened. If Jiang qi is including wei qi is weak, the body will be more easily be invaded, and this is because the body will not be able to protect and defend itself. This means that pathogenic qi does not need to be as strong or to have affected the body for a prolonged period of time. A weak or weakened Jiang qi is typically seen in infants, older people, people who are physically run down, and people who have been ill. To illustrate this, imagine an old lady and a young man who have to go up from their house to the corner shop, which is 400 meters away. It is freezing cold, and both of them are only wearing a thin coat. It is much more likely that the old lady will catch cold as a result of this trip than the young man. Her wei qi is not strong enough to withstand the onslaught of the wind and cold. It is typical that some people catch every bug that is going around while others rarely fall ill. This is usually a reflection of the relative strength of their wei qi. If this pathogenic qi is very strong, the body is subjected to a very strong influence of pathogenic qi. It will have a difficulty keeping it out, even though the wei qi is robust. Returning to the young man from the previous analogy, walking down to a thin shop in a thick jacket in winter will probably not result in him catching a cold or becoming ill. This is because his wei qi is robust. However, it is highly likely that he will catch a cold or fall ill if he falls through the ice on a lake into a freezing cold or cold water below. Even though there is no difference in the length of time he is exposed to cold, there is a difference in the intensity of the cold he is exposed to. This is also seen in some virulent diseases where the majority of the population, including strong, healthy individuals, fall ill when exposed to the disease. Now let's talk about prolonged exposure to pathogenic qi. A prolonged exposure to a certain form of pathogenic qi will wear down body's defenses. Imagine the same young man. He will not become sick from walking to the shops in freezing weather with a thin jacket. But if he had to walk around town in freezing weather with only a thin jacket for 2 hours, it is more likely that he would become ill afterwards. This time it is not the strength of the cold that is crucial, but the prolonged exposure to it. Imbalances that arises as a consequence of prolonged exposure to a certain type of pathogenic qi are seen, for example, in people who live or work in an environment that is characterized by a particular climate, such as living or working in a place that is cold and damp. Now let's talk about sudden exposure to pathogenic qi. Illnesses can arise when seasons change or when the weather is atypical for the season. It is as if wei qi does not have time to adjust to this atypical climatic influence, as if it has prepared itself to protect the body against something that is, for example, yin, and all of a sudden there is something that is yang. We often see people catch a cold when the person of mild weather in winter or during a cold and wet period in summer. This is also the reason that many people get sore throats and colds from air conditioning, especially in hot climates. The pores of the skin are wide open due to the heat, and then they come into a building that is quite cold, and the air conditioning also creates drafts or wind. In addition, many people will fall ill in the transition from summer to autumn and from winter to spring, the classic spring cold. The presence of imbalance in the body. So a person is more likely to be adversely affected by a specific form of pathogenic qi if they already have a similar imbalance. A person with a yang deficiency will be invaded by cold more quickly than a person with excess heat. A person with spleen imbalances is more rapidly affected if there is dampness than a person who is yin deficient. Thank you for your attention.
Let's discuss diagnosis according to 12 regular channels. The overview. The channels and organs form a holistic structure where changes in one will affect the other. This means that the organ imbalances can manifest with a disruption of the associated channel and vice versa. Although organs and channels are intricately linked, there can still be and often are imbalances in one without these manifesting in the other. Diagnostically and therapeutically, it is therefore most appropriate to diagnose them separately and use diagnoses according to some organs to diagnose organ imbalances. Channel imbalances can arise when a channel is invaded by exogenous pathogenic qi, when there is a repetitive movement or strain of a limb or joint, when there is a physical trauma, and when there are imbalances in the channels related to some organ. The diagnosis in relation to the 12 regular channels is most commonly used in the diagnosis of musculoskeletal problems and B syndromes. The diagnosis in relation to the 12 channels focuses on which channels are affected. Channel diagnosis is, by definition, an exterior imbalance in relation to the 8 principles. The channel diagnosis can relate to an interior Sangfu imbalance. Diagnosis will be based on where in the body changes have manifested themselves. These changes should be seen in relation to the internal and external pathways of the 12 regular channels. It is important to determine whether there is a deficient or an excess condition. Palpation of the channel is indispensable in this process. The muscles along the path of the channel should be palpated to see if there are any changes in the tissue. Changes in the tissue could be the presence of nodules, graininess in the tissue, sponginess, tightness, hardness, softness, or weakness. There can also be changes in the temperature and moistness of the skin along the channel. The size, depth, and hardness of any changes along the path of the channel are also important diagnostic factors. Tightness, hardness, and tension are usually indicative of an excess condition in the channel or its associated organ. The more superficial the hardness, the more acute the condition is likely to be. Softness and weakness in the tissue along the path of the channel is a sign of a deficient condition in the channel or its associated organ. If there is a deficient condition, the palpation will feel more pleasant for the patient than if there is an excess condition. Cold and blood stagnation can manifest with nodules that are hard with clearly defined edges, whereas phlegm and dampness nodules will tend to be smoother and more slippery with less clearly defined edges. Longer, more stick-like nodules can also be felt along the path of the channel. If the stick-like nodules are bumpy and lie along the channel, it is a sign that it is a chronic condition that can be difficult to treat. stick-like nodules that can be felt transverse to the path of the channel are typically acute or are due to stagnations of qi and are thereby easier to treat. If the patient reports sensation of numbness while an area is being palpated, this can be due to phlegm blocking the channel. Additionally, individual acupuncture points along the channel should be palpated to see whether there is a tenderness or pain or whether the patient feels the pressure is pleasurable or gives some form of relief. There can be changes in the temperature of the skin along the channel when there is heat or cold in the channel. Visual observation of the channel is also important. Heat in the channel can be manifest with redness along the channel's path or with spots, pimples, or other skin changes. Observation of the joints is particularly important. This is because it is at the joints that qi sinks deeper into the interior or rises up to the surface. This means that it is a place where pathogenic qi tends to accumulate. Problems with sense organs and the body's orifices can often result from imbalances in the channels rather than the some organ that is controlled by. Excuse. For example, many problems in the ears are due to imbalances in the small intestine, gallbladder, or Sanjiao channel, and not the kidney organ. It is important to remember in diagnosis according to the 12 regular channels that it is not only the channel main force that is of relevance. The channel's internal pathway, the muscle channels, the loop connecting vessels, and the pathways of the divergent channel must also be taken into account, as well as the channel's relationship to its partner channel and its extended channel. We have here the table for the excess condition in the channel. There is tenderness, tightness, and tension along the channel, while in deficient condition in the channel, there is weakness in the muscles and connective tissue or muscle atrophy along the channel. For the excess condition, there is tenderness or pain on palpation of the channel, where in deficiency, there is relief of pain or pleasure in palpation of the channel. For the excess condition, there is a pronounced cramping or sharp pain in the joints along the channel, while in deficiency condition, there is soreness, weakness, numbness, or fatigue in the joints along the channel. For the excess, there is red coloration for heat or bluish coloration for cold along the course of the channel. While in deficiency condition, there is pale color along the channel course. For the excess condition, the channel feels warm, while in deficient condition, the channel feels cold. For the excess condition, there is the relevant pulse position is full, while in deficiency condition, the relevant pulse position is weak. For the treatment in excess condition, it is treated with draining needle techniques, while for the deficiency, it is treated with tonifying needle techniques. For the heat in the channel, another table, differences with the heat in the channel and cold in the channel. For the heat, the channel feels warm, while for the cold, the channel feels cold. For the heat, there is redness of the skin, there is pimples, spots, or other red coloration along the path of the channel. While for the cold in the channel, there is bluish or very white skin along the path of the channel. For the heat, there's a pimple, spots, or other red skin conditions along the path of the channel. For the cold, there is hard, clearly defined nodules in the tissues along the path of the channel. For the heat in the channel, there is inflammation, redness, dryness, or yellow sticky exudation from the sense organ or orifices that the channel connects to. While for the cold, there is increased watery discharges from the sense organ or orifice that the channel connects to. For the heat, there is a burning, stinging pain in the sense organ or orifice that the channel connects to. While for the cold, There is a cramping, intense pain in the sense or place that the channel is. Again, for the stagnation in the channel, there is dark or purple discoloration skin along the channel. There is also a sharp stabbing pain along the path of the channel. It is inhibited. There is an inhibited movement of the joint along the path of the channel. It is also hard, clearly defined nodules in the tissue along the path of the channel. Thank you for your attention.
We continue with treatment principles, when to tonify upright qi and when to expel pathogenic factors, the second part. Upright qi is not a particular type of qi, but simply the sum total of all the body's qi, mostly in relation to its capacity to fight pathogenic factors. Upright qi could therefore also be described as the body's resistance to disease. It is a term which is used only in relation and in contrast to pathogenic factors. Pathogenic factors, in Chinese called Si, which means evil, indicate any disease factor, whether exterior, such as external wind, dampness, cold, heat, or interior, such as phlegm, fire, interior wind, interior cold, stasis of blood, or stagnation of qi. An excess or full condition is characterized by the presence of a pathogenic factor, whether interior or exterior, while the upright qi is still relatively intact and fights the pathogenic factor. A deficient condition is characterized by weakness of the upright qi and absence of a pathogenic factor. A mixed deficient excess condition is characterized by weakness of upright qi, but also by the presence of a pathogenic factor. Although there is a pathogenic factor, the upright qi is weak and does not react adequately or successfully to the pathogenic factor. This is a very common situation in practice, probably more common than a purely excess condition. So we have here the differentiation between Cheng qi, or the upright qi, and the pathogenic factor. Full Cheng qi is intact, fighting pathogenic factor, and pathogenic factor is present. For empty condition, the Cheng qi is weak, no pathogenic factor. Full empty, Cheng qi compromised, fighting pathogenic factor weakly, pathogenic factor is present. A full condition is characterized by presence of pathogenic factor, whether interior or exterior, while upright qi is still relatively intact and fights pathogenic factor. An empty condition is characterized by weakness of upright qi and absence of a pathogenic factor. A mixed full empty condition is characterized by weakness of upright qi, but also by the presence of a pathogenic factor. Although there is a pathogenic factor, the upright qi is weak and does not react adequately or successfully to the pathogenic factor. All the various pathological changes and developments of disease can be seen as various stages in the struggle between the upright qi and pathogenic factors. All the numerous changes, improvements, and aggravations are due to fluctuations in the relative strength of the upright qi and pathogenic factors. When planning a treatment, it is essential to have a clear idea as to the relative strengths of upright qi and pathogenic factors, or whether there is a pathogenic factor at all. This is important in order to adopt the correct strategy of treatment. The main question is whether the condition calls for tonification of upright qi or expulsion of pathogenic factors, or both. If both are required, should they be applied simultaneously or in succession? And if so, which one should be applied first? In order to answer these questions, we can consider three possible approaches. 1, tonify upright qi. 2, expel pathogenic factors. 3, tonify upright qi and expel pathogenic factors. In this last case, there are still 3 possible courses of action. First, tonify upright qi, then expel pathogenic factors. First, expel pathogenic factors and tonify upright qi. Tonify upright qi and expel pathogenic factors simultaneously. It should be noted that although in many cases the root coincides with deficiency and the manifestation with the pathogenic factor, this is by no means always so. The case of deficiency of spleen qi leading to dampness, or that of a liver blood deficiency leading to liver yang rising, are common examples in which the root is a deficient pattern and the manifestation an excess one. However, there are many cases when this is not so. An exterior invasion of a pathogenic factor is an obvious example in which the root, for example, external wind, is a full condition. In the case of cold invading the uterus and causing blood stasis, both the root and the manifestation are full. Finally, a full-type manifestation can itself become a root. Phlegm is a common example of this, as phlegm itself is a full-type manifestation deriving from a deficient root, spleen and kidney deficiency. After a prolonged time, phlegm itself can become a cause of further pathology and therefore turn into a root. Thank you very much for listening.
Let's continue our discussion on diagnosis according to Jiang organ patterns with Lung Yang Deficiency. Lung Yang Deficiency is seen when the lung lacks the necessary activating heat to perform its activities and functions. It is a pattern that is not commonly described or listed in many textbooks, its symptoms and signs being attributed to the combined pattern of lung qi deficiency and kidney yang deficiency. Treating these two patterns simultaneously will also provide excellent results. Lung yang deficiency will arise from the same etiological factors that cause lung qi deficiency. Factors such as repeated inhalations of exogenous cold, overexertion, and consuming cooling foods will often be involved. Signs and symptoms. With pensive fatigue, breathlessness, shallow breathing, slight cough, possibly with watery sputum. There will be edema in the face, arms, and hands. Frequent urination with copious amounts of pale urine. With cold limbs, the person is sensitive to cold and has an aversion to drafts. The person wears warmer clothes than is normal for the season or room temperature. There is weak voice, sunken chest or slump posture, reluctance to speak, pale lips, spontaneous sweating, frequent colds and respiratory infections, bright white complexion, pale or normal colored tongue with a wet coating. The front third of the tongue may be hollow. There is a deep and weak pulse, especially in the right zone position. The key symptoms here are aversion to cold, fatigue, breathlessness, spontaneous sweating, and a pale and wet tongue. For the treatment principle, we tonify and warm Lung Yang. The acupuncture points we can choose from Lung 1, Lung 9, with 13, Do 4, Do 12, Bren 6, Bren 17, Kidney 3, and Kidney 7. We use the tonifying needling technique, and Woksa is recommended on Lung 9, Do 4, Do 12, and Kidney 3. To explain further on the choice of points, Lung 1, Lung 9, Do 12, UB13, tonify Lung Qi and Lung Yang. Kidney 3, Do 4, and Ren 6, tonify Yang in general. Ren 17 tonifies Zong Qi. Kidney 7 tonifies Yang, thereby helping to transform and transport fluids in the body. In addition to the advice that is relevant for lung qi deficiency, it is important that the person keeps warm, avoids consuming cold foods and drinks, both physically and energetically cold, and does not overexert. They will benefit from getting enough rest and drinking ginger tea. Lung Yang deficiency can be caused by kidney yang deficiency and lung qi deficiency, and in turn can result to kidney yang deficiency, phlegm pool in the lungs, damp phlegm in the lung, phlegm fluids in the lung. So to summarize, lung yang deficiency has its etiology and hereditary weakness, poor posture which constricts the breath, exposure to cold, prolonged grief and sadness weakening lung qi, repeated impairment of lung qi diffusing and descending function over a long time, spleen and kidney yang deficiency. Its signs and symptoms are shortness of breath, panting, which is worse on exertion, a forceless cough with a profuse watery sputum, a weak voice, a white bright complexion, a spontaneous daytime sweating, dislike of speaking, easily catches colds, tiredness, dislike of cold, feeling cold hands, cold feeling of upper back, absence of thirst. The pulse is weak, especially on the right front position. The tongue is pale, slightly wet with white fur. For the treatment principle, warm and supplement Lung Yang. For the acupuncture treatment, we can use Lung 9, which supplements Lung Yang. Ren 6 supplements the original Qi and fortifies Yang. Blue 12 to relieve cough and dyspnea. Ren 12, this supplements earth to strengthen metal. Bladder 20 supplements the spleen. Lung 7 promotes the descending of lung qi. Bladder 13 supplements lung qi. Stomach 36 supplements stomach and lung qi. Bladder 43 supplements the lung. And spleen 3, which is the source point of the spleen, or mineral with supplementation and large amounts of moxa. Thank you for your attention.
Let's discuss diagnosis according to 8 principles. Deficient heat, part 2. Tongue diagnosis is an essential tool in the differentiation of deficiency and excess heat. In both cases, the tongue is likely to be red and dry, but when there is deficient heat, there will be little or no coating on the tongue. The lack of nourishment and gain moisture can cause the tongue to crack. The pulse will also be weaker when there is deficient heat, but it can still be rapid because the heat will have accelerated the beating of the heart. Because Yang is not rooted and anchored, the pulse can have a superficial quality when there is deficient heat. Deficient heat will also affect the heart and Shen, but the impact will not be as great and the symptoms not as intense as when there is excess heat. When there is deficient heat, the person is more nervous and unsettled than manic and agitated. They will often have a slight anxiety or a feeling that something is wrong without them being able to put their finger on what it is. If there is a palpitations, they will not be as intense as when there is excess heat. When there is deficient heat, the palpitations will often be accompanied by a feeling of nervousness or mild anxiety. Deficient heat often results in insomnia due to the Shen not being anchored by Yin. At the same time, the heat will agitate and activate Shen. Because Shen is not anchored and because Shen is agitated by heat, the person's movement may well be nervous and fidgeting. Even though a person with deficient heat will be restless, they will not be as restless and agitated as a person with excess heat. The nervousness and anxiety can sometimes be heard in their speech, both in the voice itself and what they talk about. The voice will not be as loud as it is when there is excess heat, but because heat agitates the heart, the person can be very talkative and talk quickly. For the etiology, Yin is weakened by old age, physical, mental, and emotional overexertion, including stress, disease and illness, excessive conditions, too much sex, working at night, narcotics, energetically hot and spicy food, coffee, blood loss, and profuse sweating. For the signs and symptoms, there is a malar flush, fever, or feeling hot in the evening and at night. There is night sweats, sweat or sensation of heat in the palms of the hands, the soles of the feet, and the center of the chest, dry mouth and throat. There is thirst with the desire to sip water, nervous, fidgeting movements, restlessness, slight feeling of anxiety, palpitations, nervous, rapid speech, talking a lot, dark scanty urine, constipation or dry stools, red tongue with little or no coating, possibly a cracked tongue or face. There's a rapid, fine, and possibly superficial or empty pulse. For the key symptoms, there is a night sweat, malar flush, dry mouth, red tongue with little or no coating. For the treatment principle, we have to notice the yin and control the heat. For the acupuncture points, we have to choose from kidney 2, kidney 3, kidney 6, run 4, UB23, UB52, spleen 6, and heart 6. Needle technique, we have to tonify except kidney 2, which can be treated with an heated technique. Explanation, the kidney 2, kidney 3, kidney 6, REN 4, UB23, and UB52 nourish the kidney yin, which is the foundation of yin in the whole body. Spleen 6 nourishes yin, and heart 6 nourishes heart yin. For the relevant advice, a person with deficient heat should avoid food and drinks that have a hot energy. They should also avoid stimulants such as caffeine drinks, for example, coffee, Red Bull, and green, black, and white tea. Furthermore, they should avoid having too many spices in the diet. Stress and overwork will weaken yin. It is important that the person with yin deficiency make sure that they go to bed early and sleep enough. They should avoid working on the computer too much, especially in the evening. Sweating is best avoided as it results in the loss of fluid from the body. This means that they should preferably not sit in saunas and steam baths. Dynamic activities such as aerobics or action sports should also be avoided, as they will further consume person's reserve. Meditation, qigong, tai chi, and yoga will though be beneficial. Thank you for your attention.
Let's discuss heart and lung qi stagnation as patterns for depression. Depression, sadness, slight anxiety, palpitations, a feeling of distension or oppression of the chest, slight feeling of lump in the throat, slight shortness of breath, sighing, poor appetite, chest and upper epigastric distension, dislike of lying down, weak and cold limbs, pale complexion are clinical manifestations. Tongue is slightly red on the sides, in the chest areas. Pulse, empty but very slightly overflowing on the left front position and very slightly tight on the right front position. Remember, qi stagnation occurs not only in the liver, but especially in emotional problems, also in the lungs and heart. Sadness, grief, and worry affect the heart and lungs, while sadness and grief initially deplete qi, while worry nuts qi. All three emotions, after some time, lead to qi stagnation in the chest area. The lungs are particularly affected by the sadness and grief deriving from separation and loss. This is a frequent cause of depression. The qi stagnation deriving from the above emotions affects the circulation of heart qi and lung qi in the chest and constricts the corporeal soul. On a physical level, this causes a feeling of distension or tightness of the chest and sighing. On a mental emotional level, the person is sad, depressed, and tends to weep a lot. Heart and lung qi stagnation are common in young people up to about 35. They nearly always derive from sadness and grief due to loss. Treatment principle: move heart and lung qi, calm the mind, lift mood, settle the corporeal soul. Points: heart 5, heart 7, P6, REN 15, REN 17, lung 7, stomach 40, LI 4. All are needled with even method. Heart 5, heart 7, and P6 move heart qi, lift the mood, and calm the mind. REN 15 calms the mind and nourishes the heart. REN 17 and lung 8 move lung qi. Stomach 14 and LI 4 stimulate descending of qi. Thank you for your attention.